So you want to transition from methadone to Suboxone. It's feasible to make the switch, but it's challenging, especially if you're on higher doses of methadone. The reason why it's challenging is that you could potentially precipitate withdrawal when you get onto Suboxone, aka buprenorphine. TLDR, methadone's a long-acting opioid, meaning it hangs around in your system even if you stop taking it for a few days. Most guidelines recommend tapering down on your methadone to 30 milligrams a day before detoxing off methadone for 24 to 48 hours and then starting Suboxone. Obviously, this is way easier said than done. First, most people need higher doses of methadone to keep cravings down and avoid withdrawal. So tapering down to 30 milligrams is not only uncomfortable, but it increases the risk of relapse. And then add on another 24 to 48 agonizing hours off methadone and detoxing. That's hard, especially if you have a lot of other things on your plate, like a job, childcare, etc. If you think you can handle that with some comfort meds to help with the detox, then that's one way to go. And it can work. But if you think this will be too challenging, consider discussing a micro induction, aka a low dose buprenorphine induction with your provider. Basically, when you do this, you're adding tiny amounts of Suboxone to your system day by day over the course of 5 to 10 days. During this low dose induction, you continue your methadone simultaneously. So if everything works out perfectly, you don't have to detox or go through a lot of withdrawal. This second way of getting onto Suboxone is definitely more complicated, but I've had a lot of success with it for patients transferring from methadone to Suboxone. It can also work for getting off fentanyl and onto Suboxone.